Hi again. Let's start on the cranial bones. There are 8 of them, as shown in this first slide. You should be able to list all 8 of them fairly quickly, spelling them correctly. And these are the bones that make up the cranial vault. That's how skull bones are divided into cranial and facial. Cranial bones have contact with the brain. They make the brain case. They make the cranial vault that the brain sits in. So if a bone contacts the brain, whether a little bit or a lot, it's considered a cranial bone. If the bone has no direct contact with the brain, it's considered facial. So there are 8 cranial bones. 2 of them are paired. So there's the parietal, and there's not much to say about it. It's flat, and you can identify it. And then there are 2 temporal bones, and then a frontal, occipital, sphenoid, and ethmoid. So we are going to go through these 3 today. That'll be our first lecture. And then on the second lecture, we'll do the sphenoid and the ethmoid. Again, there's not much to say about the parietal. You can identify it, that's about it. So let's go ahead and start. And just a pretty basic overview of the skull. External view. So not all bones are shown. The facial bones are not shown, are not labeled. And we are just focusing on the cranial bones. So there is the ethmoid. We looked at that earlier when we were discussing bones of the orbit. And there's a piece of the sphenoid. So these are all cranial bones. There's a piece of the sphenoid, then the temporal, occipital, parietal, etc. Next slide. Different view, inferior view. Now we're starting on the occipital bone. So again, I have a few features of the occipital bone that I want you to know. Let me take a moment to bounce out of here, if I can, and go back to our list of objectives. So, you will have read through this material. Oops. So I don't think I can mark on this with the pen that I was using. This is out showing my desktop. So at any rate, you've read the objectives, you've flipped through the terminology, you've learned some of those terms. Sometimes I might do a little matching question on an exam, but that's terminology that we'll be pretty much using, so you should learn that. Bones of the skull, we've gone through that. I'm just reading down the list of page 1. We've done the major sutures, we did that. We did bones of the orbit. And here are notes on the orbit again, and it mentions the passage of various cranial nerves into and out of the orbit, through the SOF, IOF, and we worked our way through the fossa and fissures. That was last lecture on the temporal, infratemporal, and pterygopalatine fossa. And now we are on the cranial bones, starting with occipital, and there are 3 features that we're going to be going through. So this is sort of the format that we're working through. So back to our slides. The occipital condyles are what the skull articulates with the vertebral column with. So the occipital condyles articulate with C1 first of the 7 cervical vertebrae. So you need to be able to recognize those. If I put a pointer on that feature, you need to recognize that, oh, that's the occipital condyle, and that's a feature of the occipital bone. And then we have the foramen magnum, which is the large hole. And by the way, it is not the magnum foramen. It's the foramen magnum. So please don't write down magnum foramen. I don't know where that comes from. Sort of like nails on the chalkboard, though. So in this figure, what I would do if I'm trying to learn anatomy is I would at least sort of highlight those the bones, which are bolded, and everything else is a feature of those bones. And many of those features we will be talking about. But not all. So, I would at least be able to take the labels off of this figure and look at it and start identifying bones. So, for example, if we covered up the labels and I put a question mark on that bone, you should be able to tell me, oh, that's the palatine bone. And by the way, since we've already gone over this, if I were to put a line on this suture going right down the middle and ask you, what's that? You should be able to tell me, oh, that's the median palatine suture. It continues on. For example, so spend some time studying this. The pink is all sphenoid bone, and the gold is all temporal bone, zygomatic bone, etc. So, next slide. And here is another feature of the occipital bone that I want you to know. It's the hypoglossal canal. So you need to get oriented. Inferior view, there's the foramen magnum. It's inferior view. Here is our palate and the median palatine and transverse palatine suture. So you're getting yourself oriented. You know that this is the occipital bone. And then we have these occipital condyles, which we just went through. And then if you go underneath that, there is a hypoglossal canal, which goes through the bone. And the probe is passed through that hypoglossal canal. It opens up into the foramen magnum. And the figure on the right is showing that again. Here is the occipital condyle, and the probe has passed through the hypoglossal canal. Goes underneath it. Do not confuse the hypoglossal canal, which runs into the foramen magnum. Do not confuse that with the condylar canal that's back here, which is somewhat variable. But sometimes it's a prominent foramen that does not enter into the foramen magnum. So that is not the hypoglossal canal. Hypoglossal canal, what you need to know is its passage for the hypoglossal nerve, which is cranial nerve 12. So we're learning some of the cranial nerves and how they enter and exit the skull. So I believe that's it for the occipital bone. And then we go to the frontal bone. And again, I would probably start labeling bones as I'm just looking at it until you've got it down and you know them. So the maxillary, the zygomatic bone, the mandibula, nasal bones, etc. So in this view, what I'm pointing out is the supraorbital foramen or notch. It's above the orbit, bony ridge. There's a foramen for passage of nerves and blood vessels. So if I were to put a little question mark and an arrow on that feature, you would simply at this point tell me, oh, that's the supraorbital foramen. Sometimes it looks like a notch. So if this is the orbit, something like this, it would appear as sort of a notch. In other skulls, it's a separate foramen. Either way, supraorbital foramen or notch. And again, I would practice going through, covering up some of these labels. All the bones are in bold. So eventually you're going to have to be able to look at a skull and name these bones. Okay? So, stuff to practice. Next slide. Again, supraorbital foramen, supraorbital notch. So we have the foramen on the left orbit, and this is looking more like a notch on the right orbit. Again, start identifying bones in these different illustrations because I'm very likely to give you a picture of a skull like this with the labels removed and question marks and of bones and features. So for example, again, if I were to take this picture, no labels, and I drew an arrow to that little hole, and I ask you to identify the hole, I'll give you a second to figure out what the hole is. It's the optic canal. And then I would ask you, that is a feature of which bone? Give you a second. And then you would tell me that that's the sphenoid bone. And then I could ask you what passes through that opening. Give you a second. And you would tell me that that's the passage for the optic nerve, which is cranial nerve number 2. Likewise, you could identify the SOF, the superior orbital fissure, and you could tell me which cranial nerves pass through that. That's where we're going. That's what I want you to start working on. So next slide. And all that information is what's in those objectives that I showed you earlier, the 5 or 6 pages. Okay, last feature, I believe, of the frontal bone are these frontal sinuses. These are part of the paranasal sinuses. They're variable. You can see pretty clearly that they're not symmetrical. That's okay. But those are the frontal sinuses. They're in the frontal bone. And then again, as we work through this, there are different features that we will be looking at, or that I will ask you to know, such as the Foramen Magnum and the petrous ridge or the crest. The rest of the other fossae I'm decided not to worry about and other features. But that's a good illustration of the frontal sinuses. And then the last slide dealing with the frontal bone, I'm using this slide to discuss how different processes are frequently named on the skull. So you know that a bony process is a projection of a piece of the bone. So, for example, you all recognize the frontal bone, and the frontal bone has this little piece. Frontal bone forms part of the orbit. So what I outlined in red is a process of the frontal bone. Now, how does it get its name? We're talking about the frontal bone. And this process is the zygomatic process of the frontal bone. So it gets its name, zygomatic process, for the bone that that process articulates with. And since it articulates with the zygomatic bone, that's the zygomatic process of the frontal bone. Okay? Likewise, if I asked you what that process is, that's a yellow dot, using the same logic, well, first of all, you know it's the zygomatic bone. So it's a process of the zygomatic bone. So the name of the process is the frontal process because that's the bone that it articulates with. So that would be the frontal process of the zygomatic bone. I'll give you one more to work on, well, two more, and then I'll leave it to you to figure them out, and you can talk amongst yourselves. So using the same logic, name that process and name this process. Okay? If you have questions, let me know. Moving on to the temporal bone. These figures are out of your text again, showing different parts. The temporal bone is all shaded dark. There's the squamous portion, and you remember the name of the suture, for example. Here is the zygomatic process of the temporal bone. And then there's the tympanic portion. I don't spend a lot of time talking about the tympanic part of the temporal bone. You will need to recognize the external acoustic meatus. That's the ear canal. Go inside that, you find the eardrum and then the middle ear bones, the three auditory ossicles. There is a articular fossa for the TMJ. The condyle fits, the mandible fits into the temporal bone. And then there is this Petro-tympanic fissure, which is difficult to see, but it basically runs right through here. And I'll show you a different illustration of that. A little branch of a cranial nerve passes through that Petro-tympanic fissure. Okay, let's keep going. So, inferior view of the skull again. Get yourself oriented. Good practice. If you're with a study buddy, you can just start naming some of these features that we've already gone through. So, you know, there are some labels here that I removed, but you can go through this and figure out what all these bones are. So we're talking about the temporal bone. So here is the mandibular fossa. Mandibular fossa. That's for the head of the condyle of the mandible. And here is that Petro-tympanic fissure again. It runs right along here. And this bone, I'll go ahead and point this out. This is the mastoid process. It's a large, prominent mass of bone. That's what you feel on your skull if you palpate directly behind your ear. There's a large mass, and connected to that is the sternocleidomastoid muscle. So make sure that you can find that on your skull. And if you're practicing with a partner, spend some time locating that so that you can palpate it and identify it. You should be able to identify, again, the occipital condyles, since we've gone through those. And then I might ask you if this is the hypoglossal canal. True or false? And you would say false, because you can't see the hypoglossal canal from that angle, the angle shown. The hypoglossal canal, not shown, but it runs in this direction. So this is the condylar canal, which I'm not going to ask you to know. Just don't call it the hypoglossal canal. So back to the petrotympanic fissure, it's going to be the passageway for a small, thin, important branch called the chorda tympani of the 7th cranial nerve. So we will be talking about that. So, there are different features. Spend some time going through this. This is how you learn, or how you're going to have to learn anatomy in this course. And even if we had skulls, this would be the starting point. If we had you manipulating and working with real skulls. So next slide, temporal bone. You've seen this slide before when we're talking about the frontal sinuses, but the petrous portion of the temporal bone, it's a large mass, and it runs more or less as I've outlined it in red on this slide. It looks like a long tent, and the ridge of the tent, sort of like a large, army tent, and the ridge line of the tent is running more or less like the dashed line in that direction. So I don't know if I can draw this or not, but it sort of looks like a mountain range. And here is the ridge, the petrous ridge, and I don't know if kind of, sort of. So all this is the petrous portion of the temporal bone. And there's the petrous ridge. And there are a couple of openings that we'll go through in this petrous portion of the temporal bone. And it's on both sides, of course. So here's the other petrous portion. And when you're looking down on it, from this view, it looks like a ridge. A little hard to appreciate in this slide. Okay, there is the petrous portion again. And you know that we're talking about the temporal bone. And there is the opening that I was introduced you to in the other slide. This is the internal acoustic meatus. It's inside the cranium. It's not the external acoustic meatus, which was your ear canal. And the internal acoustic meatus, which is this hole right here, through that opening pass cranial nerves 7 and 8. So, cranial nerves 7 and 8 pass through the internal acoustic meatus. Next slide. Styloid process. So we're still talking about the temporal bone. In this figure, it is red. So there's our temporal bone. All that is temporal. And the styloid process is this hook that forms. And in most of the real skulls, that gets broken off because it's very fragile. I'm highlighting it with a little yellow dash on the right-hand figure. That's the styloid process. And it's shown as a little hook on the left. And there is a tiny little foramen between the styloid foramen and the mastoid process. So looking at the illustration on the left, the mastoid process is what I'm outlining in green. That's that bony mass that you can feel behind your ear. Some people call it the mastoid bone. Technically, it's not its own bone. Technically, that's the temporal bone that you're feeling. But it's the feature of it. But if somebody talks about the mastoid bone, you'll know what they're talking about. In this class, it's the mastoid process of the temporal bone. There is a small foramen between that mastoid process and the styloid process. And that's the Stylomastoid Foramen. And the Stylomastoid Foramen is, on the right-hand view, what I've just circled. And there is another branch of the 7th cranial nerve that passes through that opening. So, I believe that's enough of that slide. Still on the temporal bone, some review. The Petro Tympanic fissure is this little line, a dark line that's drawn, and pretty soon you'd be able to tell me what passes through that. Which branch of which cranial nerve passes through the petrotympanic fissure? It was in a previous slide in this lecture. So cranial nerve and branch equal question mark. What passes through that? And the Stylomastoid Foramen, again, what passes through that? Mastoid process, styloid process. The rest of it's pretty straightforward. Okay? Again, I believe that as we complete this section on the skull, you will know everything that's labeled in this illustration in your text. And just a couple of features that are relevant to the temporal mandibular joint, or the TMJ. But we're talking about the temporal bone right now. So there's an articular eminence, which is a projection bump. So it kind of dips down. That's the tubercle, or the eminence, articular eminence of the TMJ. And then on the other side, we have a fossa. So it goes from a tubercle projecting outward to a fossa projecting inward, sort of convex, concave sort of idea. And the mandibular fossa receives the head of the condyle of the mandible. And I believe this is the last, and we will talk about the TMJ in more detail later. And this is the last slide of the temporal bone for this I want to discuss. Give me just a second here. Yeah, last slide of this lecture also. So what I want to point out is that this mastoid process, again, this is what's prominent behind your ear, all of this, is hollow, and it's made up of these air cells. So it's more or less hollow, if you will. But those air cells have pretty direct contact with the cranium. So what I want to stress is that if there's a middle ear infection from the middle ear, it's very close in proximity to these mastoid air cells. So sometimes an infection can spread into those air cells, and if it gets into those air cells, then it's pretty direct and close to getting into the brain. So if you have an infection, it is bad news. So what I would like to stress with you all, since you will be evaluating and assessing patients, any infection of the head or the neck needs to be taken quite seriously and treated aggressively. If somebody has an infection in the head, the scalp, the oral cavity, that needs to be treated before they leave the clinic. You need to get the doctor in there, the dentist in there to evaluate that, and they should probably be referred to higher medical care if necessary. That needs to be treated aggressively because there's the risk of it spreading into the brain. Okay. And we're done with this short lecture segment. And the next lecture we will finish off the remaining cranial bones. So we'll see you soon. Bye.